push with your contractions, okay?
Next contraction, big push. Let's have this baby, Jasminder.
Oh, I think one more is going to do it.
And it's going to be out.
Good job.
Oh,
Congratulations.
Great job, everyone. We just had a baby.
Mother coming in the immediate stages of delivery is pretty nerve-wracking.
So that was a lot more realistic. I was like nervous. The patient is actually like screaming.
Yeah. Is your contraction done? Let's see.
Pretending to be a mom in labor. At first, it was just like, I felt really silly. I was kind of shy, but you know, now it is very rewarding.
I was holding the baby and thinking, don't drop the baby. It was realistic in the way that it was slippery and definitely a memorable experience.
The Simulation Center has existed since 2012, and we are now occupying an 11,000 square foot space featuring 9 high-fidelity simulation rooms. We get an average of 600 nurses through our program each year.
What makes this simulation center really unique is that it's a hospital-based simulation center that really focuses on nursing. Our residency and fellowship program typically runs anywhere from 12 to 20 weeks of classroom simulation and then also precepted clinical time. Our biggest focus lately has been on integrating diversity and equity, inclusion, implicit bias work into what we're doing. Changing the skin tone of a mannequin isn't putting DEI into practice. It's so much more than that. It's understanding why we're doing that. What health disparities are we seeing? We're really focused on what we call high-risk, low-volume events.
Adult, I'm in room 307.
Things that don't happen very often, but when they do, can go really bad.
Adult, code blue, room 307.
Our focus is making sure that they can critically think through situations.
Let's go ahead and check another set of vital signs.
Okay. Most nursing schools do have simulation. However, they might have been working for a grade. But here in the Swedish Simulation Center, it's a non-punitive environment.
It's okay to make mistakes. This is where we learn. That's how we learn. So they are free to really engage in the process and make it as real as possible.
600 ibuprofen.
Okay.
And you ask your provider or you ask your other RN, and there's no shame in that at all. It's definitely a learning experience.
Our simulations follow a standardized curriculum, and they always start off with some form of pre-learning.
Making sure the learners understood any kind of didactic that they did prior to the simulation.
We do a walkthrough where the learners are given an opportunity to see the simulation center so they feel really comfortable before they start their simulation.
Charge nurse.
The simulation here, it seems more like a hospital.
There's the med room, all your vital sign equipment. You have a WOW in there for all your charting, onto Epic's Playground, the EMRs. It has everything.
We have a diverse selection of mannequins ranging from adults to pediatrics to neonatal. All of our mannequins that we use for simulation are what I would consider a high fidelity mannequin. That means they can allow the nurses to perform most assessments and interventions you would do on a real person. Well, our mannequins have pulses in all the areas you would expect. You can get a blood pressure on them. They have real chest rise. You can listen to their heart, lung, and bowel tones. Their eyes are reactive to light. They can open, they can close. Some of our mannequins can even sweat. These things really help improve the immersion of the simulation.
Sometimes we'll have an actual live person playing the role of the patient instead of a mannequin.
One of the roles of a standardized patient that I play here in the Swedish Simulation Center is a young woman who comes into the emergency department with suicidal ideation. No, I just haven't been feeling myself and die. I've been a nurse for 18 years and I have taken care of this particular patient in the past, and I try to bring out the best that I can, what I've seen in these patients, so I can provide the best experience for these nurse residents. Well, I don't feel very safe when you take all of my personal belongings away from me. Yeah, they're my pills that I brought from home. I bought these with my own money. And we want to see how they respond to that behavioral crises.
Yeah, they're doing pretty good with trying to get you to come down. So yeah, go ahead and let him.
Debrief is really where all the learning happens in simulation.
So they dissect what you were thinking and what your actions were and guide you through what a correct action would be.
They catch everything, every little thing, and then we get into the bigger picture, the critical thinking, what could we have done differently?
That's where you really see those aha moments. That's what's so magical about simulations for me. The light bulbs seem to go off. One of the coolest things about being able to facilitate simulations is having the opportunity to watch nurses interact with patients. I'm really excited that Providence-Swedish is making efforts to help new nurses identify their own implicit unconscious biases. Because we focus so much on creating a safe learning environment, speaking to each other in a respectful way, it's really important for us to have the conversation. It gives them ways to improve the way we treat our patients.
So for me, this was the first time I've ever done a fellowship, and I really wasn't sure what to expect. I was at first a little apprehensive about that. I remember nursing school and I don't know if I want to do that, but after the first couple times I realized like how valuable that time actually is spent.
I was a new nurse 18 years ago. I started my career at Swedish, and we didn't have this nurse residency program. And one of the projects I was given in graduate school was to work here in the Swedish Simulation Center. And I just fell in love with it. I was like, this is so awesome. I wish that I would have had this as a new nurse. It's really cool to see it full circle and see those learners out on the floor after they've gained confidence being in the Sim Center.
I've been an employee for Providence-Swedish for 21 years. The things that I really love about my role as a professional development specialist is I get a chance to build my own relationships with nurses as they are growing into their careers. They're really rising to the top, and when I hear like success stories like that, that is where I feel like I find the most joy in my role.
So when I was 13, I had to have spinal surgery for scoliosis. Being kind of scared and alone and away from my family. It was the nurses that I remember the most. Choosing Providence-Swedish is one of the best decisions I personally made.
The educators, whether it be your nurse instructor or the simulation instructors, like everyone wants you to be a better nurse.
So now that I'm here, like I can honestly say like I reached my goal. I'm happy that Providence-Swedish actually took me into their fellowship because they're helping me like get there, so I can't thank them enough. Yeah.